The advances in robotic spine surgery are some of the most exciting in the field in the last 10 years, in my opinion. I was lucky enough to first experience spine surgery using a robot in 2007, but the science has really advanced tremendously in the last 5 years or so. At Reston Hospital, I've been using the robot to perform multiple different types of spine surgery. The most common use of the robot in spine surgery is to perform minimally invasive spine surgery. Using the robot, we can perform spine surgeries through smaller incisions, with less dissection, less cutting of tissues, and this allows people to have less pain, faster recovery, and it offers the benefit of less radiation in the operating room to the patient and to our OR team. I'm also the only surgeon in the area using robotic surgery to perform more complex spinal surgeries such as scoliosis reconstruction. These are patients who have very complex spinal problems, and the anatomy that we have to deal with during surgery can be challenging. Using robotic surgery can help us to improve the accuracy of the surgery that we're performing and thus the safety for the patient. This allows us to offer the patient better outcomes with major surgical reconstructions. I'm also very excited to have performed the first open sacroiliac joint fusion in the world using robotic guidance. The sacroiliac joint is a joint at the base of the spine where it attaches to the pelvis. For patients who need surgery in this complicated area, adding robotic guidance can improve the safety and the success of the surgical procedure. We're proud to be the first advancing this science. I'm proud to be part of the robotic spine surgery team at Reston Hospital and to be the surgeon who's performed the most robotic spine surgery in this region, having performed over 100 robotic spine surgeries at this time. I'd like to show you a little bit about the Mazor Renaissance robot. This is the actual robot that we use during surgery. You can see it's very small and it has an arm that extends off. Inside the robot are a series of pistons that can rotate and turn to position the arm in a very, very precise location. When we're doing spine surgery, the anatomy is very, very small and delicate, and it is critical that we hit a bullseye every single time. The Mazor robot helps us to be more precise. When we perform a robotic, minimally invasive spine surgery, we don't have to cut open the skin or detach the structures from the spine. We're actually able to mount the robot near the patient with the skin intact. And then the robot moves and guides us. It helps us to work to a precise location underneath the skin without ever actually dissecting in and seeing it. And then the robot guides us using teeny instruments through little incisions to work down to the level of the spine without actually ever opening everything up. So that allows us to do smaller incisions, safer surgery, and get people out of the hospital faster.